there, Mr. Scott. How you doing?
Shannon Scott is having his oxygen level, blood pressure, and prescriptions checked. Nurses and sometimes doctors bring hospital care to his home in Jacksonville, Florida.
How's that looking? 98.3. Great.
Shannon, a 20-year veteran of the Navy, has severe rheumatoid arthritis that has weakened his lungs and liver.
And what does that do? What does it feel like?
If you can imagine drowning, that's the condition I have.
Shannon was asked to be part of the Advanced Care at Home program at the Mayo Clinic. A special team outfitted his living room with an internet connection, IV, monitors for his vital signs, an iPad for video calls, even a landline directly to his medical team.
Your oxygen saturation is 96%.
Pretty cool.
15 miles away, doctors and nurses are watching Shannon and about 40 other patients across Florida and Wisconsin.
I'm hearing what could be the hospital of the future coming to a city near you. This is the command center for the Mayo Clinic's Advanced Care at Home. And here, doctors and nurses are working 24/7, monitoring patients who are at home. They can order IVs from here, put in a prescription. They can even dispatch an emergency crew to a patient's location when needed. And get this, they're also monitoring the weather where every patient lives in case of something like a power outage or a hurricane.
His blood sugar has been controlled, 140s to 170s.
Like a traditional hospital, the staff makes their daily rounds, planning out how to care for their patients.
He responded pretty well to the Toradol.
I think I'm practicing the best medicine I have in 18 years here with this new system.
Dr. Michael Maniaci is Shannon's physician. He says technology allows doctors to give patients hospital-level care from the comfort of their homes, which allows patients to spend time with family, move around, and potentially recover faster with less risk of infection.
What data do you have showing that this is safe?
So we're collecting quality data just like we do in the brick-and-mortar hospital on mortality, medication errors, falls, readmission rate. It's about equivalent to what we found in the hospital setting.
Today, Shannon gets a virtual doctor's visit.
Hi, Mr. Scott. How are you? It's Dr. Maniaci in the command center.
And how's your breathing today, Mr. Scott?
Wonderful. I'm starting my 7% saline solution this evening.
The service isn't for everyone. Doctors say it works well for acute care patients, which includes people with cancer, severe pneumonia, congestive heart disease, or patients waiting for organ transplants. Dr. Pippa Shulman of Boston-based Medically Home helped design the program. She says as more hospitals offer this care, consumers will pay less.
When you're not supporting the overhead of the hospital, you can take that cost out of the system. And we really want consumers to be paying less than they're paying now.
How do you reassure patients that their data is going to be safe, that their health care that's being delivered is going to be safe?
We can reassure patients and their families that our technology is to the highest standards of safety and security. It is individualized to them and can't be accessed from the outside.
After spending nearly a month away from his family in the hospital, Shannon Scott says being at home is the best prescription he could receive.
I tell my wife every day that I love her. I tell my son I love him. Right. And I don't take anything for granted. Who be good boy?
And by the way, everyone you did see in that story is fully vaccinated, which is why we weren't masked for our interviews. Medically Home has already served more than 4,000 patients in hospital groups across the country, including Mayo, Kaiser Permanente, and Adventist Health. Right now, Medicare and Medicaid patients are fully covered. If you have private insurance, that's when you want to ask your company about this potential hospital at home care.
It's such an interesting trend, and it seems like just being home for so many of these patients may be a place where they can heal better, right? In a comfortable surroundings.
100%. Would you rather be in a hospital room or, you know, in your living room, in your bedroom, right? And the fact that we had the pandemic, everyone's so used to video conferencing, it sort of accelerated people's ability to speak to their doctors in this way.
And you're not around other sick patients, which is better for your overall health as well.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.